All right, let's get right into it. Today, we're taking a deep dive into the body's master filter, the urinary system. We're going to see how this incredible powerhouse keeps us in perfect balance. And, of course, what happens when that whole filtration process starts to go wrong. So here's our game plan. First, we'll get a handle on the system's basic design. Then we're going to dig into why things break down. We're talking everything from painful blockages to nasty infections. And to wrap it all up, we'll look at what happens at the critical point of total system failure and the amazing solutions that give people hope. Okay, let's start with the powerhouse itself, your kidneys. They're working 24/7, playing this absolutely vital role in keeping your entire body running smoothly. And just to give you a sense of how vital and how vulnerable these organs are, get a load of this number. Over 63,000 new cases of kidney cancer are diagnosed in the US every single year. That's exactly why knowing how they work is so important. It's really the first step to protecting them. I find it helps to think of the system like a factory team. You've got the upper track, that's the kidneys and ureters. They're the factory, filtering blood and making waste. Then you have the lower track, the bladder and urethra, that's your warehouse and the exit ramp. And their one shared mission, to maintain homeostasis, that perfect internal balance, by making absolutely sure the trash gets taken out. Now let's zoom way in, down to the microscopic hero of this entire operation, the nephron. Each one of your kidneys has about 1 million of these tiny little filtration units. And believe me, they are doing all the heavy lifting. They're the ones separating the bad stuff from all the essential things our body needs to keep. So what happens when that super intricate filtration process starts to break down? Well, in this section, we're going to look at 2 big problems that get their start right inside the kidneys themselves. First up, an issue that a lot of people are unfortunately pretty familiar with, kidney stones. The technical term is nephrolithiasis, but really they're just hard deposits of minerals and salts that form inside the kidneys, and they create what is essentially a very painful plumbing problem. So you might be asking, where do these things even come from? Well, it's usually a combination of things. Living in a hot climate can cause dehydration, which makes your urine more concentrated. Your diet plays a huge role, especially if it's high in protein or sodium. And yep, sometimes it's just bad luck. Genetics and even a less active lifestyle can make you more likely to form them. All right, the second major problem isn't a blockage at all, it's inflammation. It's a mouthful, but it's called glomerulonephritis. This is when the glomeruli, remember those tiny filters inside the nephrons, get all inflamed and angry. And it often happens because of an infection somewhere else in your body, like strep throat. So how would you even know this is going on? Well, when the filters aren't working, fluid starts to back up. That causes swelling, which, fun fact, often shows up around the eyes first. Your urine might look kind of smoky. That's a sign of blood. And your blood pressure can shoot up from all that extra fluid. And of course, flank pain is another classic sign that your kidneys are in trouble. Okay, let's continue our journey down the urinary tract and talk about the single most common problem that affects the whole system, infections. Urinary tract infections, you've probably heard them called UTIs, are, and this is a quote, the most common outpatient infection. It's huge. And they're usually caused by a very familiar bad guy, E. coli bacteria, that travels up the urethra and into the urinary tract where it just does not belong. Now, this is a really important distinction. Not all UTIs are created equal. An uncomplicated UTI is usually just in the bladder and happens in an otherwise healthy person. But a complicated UTI, that's different. It happens in someone who has other health problems, like diabetes or maybe a catheter, and it carries a much bigger risk of spreading to the kidneys, which means you need way more aggressive treatment. And when that infection does make the trip up from the bladder to the kidneys, it gets a whole new name, pyelonephritis. This is not a simple bladder infection anymore. We're talking about a serious kidney infection that needs immediate medical attention. So how can you tell if that infection has spread? Well, you'll start to see symptoms that affect your whole body. On top of the usual UTI signs, you'll probably get that flank pain, a high fever with chills, maybe even nausea. These are all red flags that the infection has become much more serious. Okay, let's take a quick pause here, look at the slide. Who do you think has the greatest risk for a UTI? A man with kidney stones? A pregnant woman who's had them before? An older man with an enlarged prostate? Or an older woman who has a urinary catheter? If you picked D, you are absolutely right. While everyone on this list is at risk, a foreign object like a catheter is basically a direct highway for bacteria into the bladder. It's the single biggest risk factor there is. All right, for our final section, we're going to zoom all the way out. What happens when the damage to the kidneys isn't just a temporary setback, but becomes widespread and, well, irreversible? And more importantly, what can we even do about it? This brings us to chronic kidney disease, or CKD. The key words here are progressive and irreversible. Unlike a sudden injury, CKD creeps up on you, developing slowly over many years. And it's often driven by two of the most common chronic conditions out there, diabetes and high blood pressure. We measure CKD in 5 stages using something called the glomerular filtration rate, or GFR. You can think of it as a score for how well your kidneys are doing their job. In stage 1, the damage is pretty minimal, but the disease marches on until you get to stage 5, where a GFR below 15 means your kidneys have basically failed. Now, it's really important to contrast this with acute kidney injury, AKI. CKD is a slow burn. AKI is a sudden fire. This can happen in 3 main ways. Pre-renal, which means not enough blood is getting to the kidneys. Intrarenal, meaning there's direct damage to the kidneys themselves. And post-renal, which is a blockage downstream, like a big kidney stone. So whether the cause is a chronic decline or a sudden acute event, the final stop is the same: end-stage renal disease, or ESRD. This is the point where the kidneys just have so little function left that they can't support life on their own anymore. But that is not the end of the line. For patients with ESRD, we have 2 truly remarkable, life-saving options. There's dialysis, which uses a machine to do the kidney's job of cleaning the blood. But the best treatment, the one that offers a much higher quality of life, is a kidney transplant. And that leads us to our final big picture question. A transplant can mean freedom, but the simple fact is that the demand for kidneys is way, way higher than the supply, and this presents a massive challenge for modern medicine. So, what does the future of treating kidney failure even look like? What new ideas will help us bridge that gap?